Welcome everybody, my name is Viktor Weninger, and today I would like to introduce the up-to-date strategies in the injection therapy of partial rotator catheters and prevention of Cutibacterium acnes infection after shoulder surgery. I am from Orthopaedic Department, Semmelweis University, and my supervisor is Gábor Skalický. Methodologist supervisor is Norbert Kovács, and the statistician is Gergő Algocs. Actually, our mission to use fewer steroid injection in our practice and reduce the C. acnes culture with effective skin preparation. And our vision, fewer side effects in patient thanks to fewer steroids and less frequent surgical side infection due to less C. acnes germ count. We have two main topics: the comparison of safety and efficacy of different injection in catheter, and peroxide skin preparation reduces the incidence of C. acnes around the shoulder joint. Let's talk about the first issue, the comparison of safety and efficacy of different injection therapies for partial rotator catheters. Rotator cuff disorders are the most frequent disorders of the shoulder. The prevalence of the cuff disorders elevated with aging, and if the patient have symptoms, have pain and inflammation in the shoulder, it's necessary to reduce the pain, necessary to reduce the inflammation. At this point, we usually use our gold standard medication, the subacromial corticosteroid injection. All of you knows that corticosteroids have many side effects like musculoskeletal, metabolic, cardiovascular, and so on. We have some RCTs which show us there are some issue to replace the steroid with other medicine. Our question is, what is the difference between the effectiveness and safety of steroid injection and other injection for partial rotator catheters? We are comparing the corticosteroid injection with hyaluronic acid, PRP, hyaluronic acid plus PRP, adipose-derived regenerative cells, and saline solution. We are investigating the visual scales, the clinical scores, and side effects. Our hypothesis: different injections have a similar efficacy, but fewer side effects than the steroid. After the duplication removal, we had more than 5,000 different articles, but only 7 eligible full text we had. Here's our very first graph, which shows the 7 RCTs, more than 400 different patients. The size of the squares shows how many interventions we had, and the sticks, the green sticks, show how many comparisons we had in different medicine. 6 different medicines: corticosteroid, hyaluronic acid, PRP, saline, adipose-derived regenerative cells, and hyaluronic acid plus PRP. Here is our first graph. This shows the constant Murley score. Constant Murley score range from 0 to 100 points. 0 is the worst, 100 is the best point. It's about the range of motion of the shoulder, the painful of the shoulder, and the general feeling of the patient by the shoulder. It's really interesting that we have significant better outcome compared with the placebo in the PRP, hyaluronic acid, and hyaluronic acid plus PRP. But after the 6 months progression, we didn't have any significant relevant difference comparing with the saline, the placebo solution. At this point, I would like to talk about the American Shoulder and Elbow Surgeon score, which shows significant better outcome after 6 months, only with hyaluronic acid plus PRP medicine comparing with the saline solution. And the last graph of my issue is the visual analog scale, which shows only the hyaluronic acid plus PRP had a better outcome, a significant better outcome than the placebo solution. Summary: of course, our study has a strengths and limitation. Strengths is compare different drugs against placebo. We can decide which agents are the most effective, and we investigated only partial rotator catheters. It's really important. We excluded the tendinitis, tendinosis, and the full tear. We had some limitation. Unfortunately, we had only 7 eligible articles, and the multiple active ingredient were used in the steroid group was triamcinolone and sinolone and methylprednisolone, not only one type of medicine, only one type of steroid injection. And the other very big limitation was only a bad data reporting. For most articles, we have no data on the exact p-value. Without exact p-value, we could do only a conservative estimation. In conclusion, as we have seen in the figures above, there are better methods than saline. We can replace the steroids, or we should replace the steroid with hyaluronic acid and hyaluronic acid plus PRP. They have a clear positive effect in the short term. And hyaluronic acid plus PRP also showed better result at 6 months progression. We have some suggestion that further RCTs are needed, and it's recommended that only partial rotator cuff tears be investigated and rule out the tendinitis, tendinosis, and the full tear. Summary, we can say some implication for practice based on the constant Merle score and ACES might be worth considering replacing the steroid injection used as the gold standard with another agent. And we have some implication for research. Further RCTs is needed, excluding tendinitis, tendinosis, full tear. We need long-term tracking, more than half year, and necessary to unify or standardize the outcomes. I would like to talk about our second issue, the peroxide skin preparation, reduce the incidence of Cutibacterium acnes in skin around the shoulder joint. After the shoulder surgery, about 1% some kind of complication occurring, some kind of inflammation or infection complication occurring, and the most common organism is the C. acnes. The C. acnes is a gram-positive anaerobic bacteria which are living in the sebaceous gland. And our currently surgical skin preparation, which is alcohol-based skin preparation, we didn't have a very effective skin preparation against C. acnes, but we have some RCTs which shows the peroxide solution can reduce the gram count, the C. acnes gram count. That's why the aim of us that compare the preoperative skin preparation with and without peroxide solution to reduce the C. acnes germ. Yes, question is, does the peroxide skin preparation reduce the incidence of C. acnes in the skin around the shoulder joint? And we would like to compare the alcohol-based skin preparation without peroxide and alcohol-based skin preparation with peroxide solution. Less C. acnes germ count leads to less subsequent infection, hopefully. That was our 2 main topics I would like to talk. Thank you very much. I would like to say goodbye with this quote, which fits my PhD study. There are no mistakes, only opportunities. And if you have any questions, please don't hesitate to ask me. Thank you very much.
Thank you. The first one was fantastic. Nowadays, the clinical practice is the next. 9 out of 10 colleagues, clinicians, patients coming in with a shoulder problem, start with the injection. And if the second and the third one doesn't help, then patient is sent to a specialist, ultrasound or MRI scan, and then the final diagnosis is done. So we have to do vice way around, because we have to make a proper diagnosis first and then to give the injection, because steroid is a really harmful injection. So we have to change the clinical practice all the way around.
Congratulations, Viktor. I would like to ask you, in the second project, you told that you will use the peroxide with alcohol. It's step by step or mixed, or what's
yes,
the...
Thank you very much. It's a really good question. In our practice, it means we start with the peroxide solution 5 times, and after the peroxide solution around the shoulder, after get the alcohol-based skin preparation. It's very important to use alcohol-based skin preparation because it's decreased the Staphylococcus gram count of the skin. So we can't replace the alcohol-based skin preparation, but we can add plus solution to reduce the C. acnes.
Yeah, and why is it the Cutibacterium acnes is the most common organism? Because we destroy the others with the alcohol-based, and they are not so sensible for it.
Yes, thank you very much. Actually, there are so many sebaceous glands are nearby are near the shoulder and near the shoulder, and that's why we have a higher rate of C. acnes in that upper limb. Thank you very much.
In your studies, you compared hyaluronic acid and PRP and steroids. It's quite fine. So do the studies actually count for the different dynamics of this? I mean, hyaluronic acid, that probably that stays there for quite a while, although that induces some local processes. Like PRP, to my best understanding, it mainly acts actually activating some kind of pro-regenerative processes through growth hormones. While the steroids are very, very different, but the timing of this could be quite different. So, I mean, now you saw quite a few studies that, did they actually select the best timing, I mean, to follow this?
Actually, thank you for your question. If I understand you correctly, there was no exactly point when they start to use the injection therapy. So it's 7 different articles, 7 different points when they started the injection therapy. In some cases, they start with the physiotherapy, and if it's not helped, they go through the injection, and there is the other way, then they firstly use the injection therapy.